The following is a special presentation of Tony Kurre Radio. From hot dogs to cool kitties, this is Darkside of the Pooch.
That's right, baby. Another episode of Darkside of the Pooch. Give me a bark there, brother.
Bow wow.
Come on. That would be the docile tones of one Dr. Rab Stewart from the Rossbridge Animal Hospital. It is Rossbridge Animal Hospital's Darkside of the Pooch. We do it every single week right here on Tony Kurre Radio. We're getting a ton of emails, so we'll go to our Mutt Mail in just a few seconds. First of all, we're coming up on the holidays now into December. How are things at the Rossbridge Animal Hospital? Any eccentricities or any weird things happening in the world of Dr. Rab Stewart in the Rossbridge Animal Hospital?
Man, we keep it weird. That's what we do. We're like, we try to keep it as weird as possible. But you know, my bow wow was inspired by Best in Show. Have you seen that movie?
I have not.
Oh, that's got to be your research for this week, is you got to watch Best in Show, because right. There's those mockumentaries like Waiting for Guffman, and it's the same cast. It's a lot of the people that are in Schitt's Creek.
Yeah.
And so they did Best in Show, and it's a spoof on people that are into dog shows.
Yeah.
And it's really funny. But the mom, I can't remember her name right now, it escapes me, but she's in Schitt's Creek, and she's also the mom in Home Alone.
Mm-hmm.
She does a hilarious song about terriers. So that's where that bow wow. The bow wow was inspired by her.
She's great. Kevin, she's great.
Yeah, but anyway, so you ask about some weird stuff. So we had a really strange case. Some people might know about this, but there's something called a bot, B-O-T, bot fly larva.
Yeah.
And there's these flies, and when they bite, they inject larvae underneath the skin. And so, the larva starts out really small, and then it starts to grow. Is this
the larva that eats the thing from the inside out?
Well, yes.
Yeah.
Yeah.
Go ahead.
So,
yeah.
We had a dog come in, and it had a little swelling and a wound, and you can't really tell what's going on until you shave. You get the hair off. Mm-hmm. Usually these things progress with a long-haired dog because the hair covers up the wound, and the owner never really sees it. So it was a golden retriever, and it just had like a kind of a wet spot on it that had a little bit of kind of blood tinged fluid. So owners brought it in, and we shaved off the hair. And these botfly larvae, they leave it looks like a puncture wound. So sometimes you can kind of be led astray, because dogs, they roll around on sticks, or they get into fights with other dogs or cats. And so they commonly get puncture wounds. And so this looks kind of just like your typical puncture wound, but it's usually of a certain size, maybe 3 millimeters, a circle that's 3 millimeters, and it's red around it. And the way that you can kind of tell if it's a puncture wound or if it's a botfly larva is you spray hydrogen peroxide on it. And the peroxide kind of irritates the larva. And so it'll poke its little head out, like a worm in an apple. It'll poke its little head out, and it'll kind of bubble up. And so it's gross, but it's cool. We think that kind of stuff's cool. So you have to surgically remove them most of the time, because what you don't want to like reach in there like that game when we were kids, Operation. You don't want to reach in there and grab it, because if the worm like bursts, then it's a whole cleanup process, and some of the pieces can stay in there. You don't get it flushed out well, and it just creates a chronic infection. So you got to go in there and kind of make an incision around the larva, and then just remove all of the tissue with it, and then you close it up. So we had a case of that recently, and it's just really interesting and weird. It's just kind of one of those gross but cool things that we get to do sometimes.
That's kind of disgusting. And I love that because you give good disgusting stories. Speaking of that, we always have the flea and tick thing, right? We do the, was it Bravecto stuff? It works great for like 3 or 4 months. You don't have to worry about anything. And of course you can get your medications through Rossbridge Animal Hospital. Give them a call at 208-0301, area code 205. Also on Twitter at Rossbridge Vet. And it's weird because I don't like my dogs to get ticks because I know they're bringing ticks into the house and then I'm getting ticks. And normally when you have a tick on a human being, and I mentioned this, I don't know if you heard the story. Several months ago, I had an itch down in my nether region, right? And it was on my left side. And in the middle of the night, it scratched myself to the point where I started to bleed. And so I got in the shower, and this is like 3 days after I gotten, I thought maybe it was a chigger bite or a mosquito bite or something. And I got in the shower and I looked down, and it was a dark red where it looked like, it had bled and it was scabbing over. And then when I got a closer look, I realized it was a tick. I had a tick on my left testicle, and it was on there. Yeah. And it was on there for like 3 or 4 days. And before I realized what the deal was. And again, I don't know if it came from my dog. I don't know how it got in my pants, and it freaked me out. I'm thinking, and the fact that I had this thing on me for 3 or 4 days, dogs can go a long period of time if they're not on some type of a flea and tick medication. Can you talk about how ticks outside the Rocky Mountain thing are something that could really make an animal sick? What exactly does a tick do to an animal? Why is it important that they shouldn't get them?
Yeah. So bacteria.
Have you ever had a tick on your wiener?
Oh my gosh. Not on my wiener. But I've had a bunch of ticks.
And I had manscaped down there, so there was no hair. I was like, what, why would this thing even want, I guess it's because there's obviously that it's looking for a meal, but it freaked me out.
Oh, it's really scary. I can't stand it. So we have like where we live in our backyard, there's a lot of woods. It's like, it's not my property. I don't know whose property it is. It's not mine. But the kids love to go down there. And so it hasn't happened recently because we haven't been down there, but inevitably the kids will not get anything on them. I guess I'm better about the bug spray on them, but where they like to get me is the back of my knees. And so I'll be in the shower, and it's just like you said, like I know it's been on there for days because I haven't been down in the woods for a week. And then all of a sudden it starts to itch. That's how I feel them. And I'll scratch, and then you'll just kind of feel it tug, and you're like, oh, that's a tick. So yeah, I get them too. I've never gotten one on that particular part. But maybe at some point I will, but yeah, so the bacteria live in the mouth parts of the tick. And the longer that the tick is on your body, the more likely that it will inject this bacteria. So the preventatives that we give to dogs, they work really fast, and the science behind them shows that they kill the tick, and the tick falls off faster than the tick can transmit the bacteria. So that's how they work. The medications, they don't repel, but they kill, but the tick has to be on and attached, but they die sooner than they can transmit. But, Ehrlichia is a common infection that they can get. You mentioned Rocky Mountain spotted fever. Lyme disease is one. So these are all rickettsial type diseases that we can see in this area.
Yeah.
Where Lyme disease you see, the hotbed is in the Northeast. I think Connecticut is like the state that has the highest, Lyme infection rate. And it may not be Connecticut, but it's in the Northeast. So things change from year to year. But yeah, so the things that you'll see with your dog is they'll get lethargic. So they just, aren't as energetic as they would normally be. They'll get some lymph node enlargement. And, a lot of people will come in and say, my dog's glands are big. And that's what those glands are. They're lymph nodes. And there's some that are kind of at the base of the jowls that you'll feel. Mm-hmm. There's also some behind the knee and the back legs, on that kind of that part on the back part of the back leg.
Yeah.
And those can be commonly felt. There's also some in the groin and right in front of the shoulder blades that you can commonly feel. So that's called lymphadenopathy. Their lymph nodes will get big. So you see that, you see lethargy, and then you'll see joint pain. So if they come into the office and they're walking like maybe they've got a limp or something going on, and we flex, manipulate that joint, they'll be real painful, and they'll also classically have a fever. They can also get neurologic issues from tick bites. So, they're not quite seizure type activity, but they look uncoordinated. They can get neurological issues from it.
Is there a proper way to dispose of a tick? We were always, and this could be a myth, that you had to get the head, because if you just got the body, the head will live without the body and it can stay in the skin. True or not?
Not exactly true.
Okay.
I mean, you want to get the whole tick, and you want to get the mouth parts out, because like I said, the mouth part is what has the bacteria in it. But if the head stays in there, I mean, the body's eventually going to kick it out.
Yeah.
Because the tick is dead. I mean, it's not going to stay latched on, but ideally you want to get the whole thing out. They've got these we have some cool instruments, and I wish I would have invented this thing. Wish I would have thought about it, but it's called a tick spoon, and it looks like a spork almost, but with a deeper. It's almost like a spork ice cream scoop, but on like a miniature one. If you can picture that in your head,
yeah.
And it gets right underneath them and it pops them right out. It's so cool. But this is a little bit sadistic, but the way that we like to kill ticks. So if you ever find a tick on your dog, first of all, go see your veterinarian and get on some flea and tick prevention. But if you find one, you can pop it off. And if it's really engorged, meaning it's had a lot of blood, and so it's really fat tick.
Yeah.
If you have some hydrogen peroxide in your house, and a hypodermic needle, so now I don't know, we're getting into some weird stuff that most people hopefully don't have in your house. But if you do happen to have a hypodermic needle, you can put peroxide in it, and then so you can put the needle in the tick's body, the part that's really engorged.
Yeah.
And then inject that peroxide into it and then pull the needle out really fast, and the tick will burst. It will erupt like a volcano because it's full of blood, and hydrogen peroxide causes red blood cells to lyse or break. So the tick will literally explode.
You're sick. You're sick. You're sick and fun.
I can't wait for the calls from PETA.
Yeah. Go ahead.
Start calling my cell phone because we're torturing ticks, and I'm sure the office is blowing up right now.
Of course, you're talking to a guy that we used to get roaches. When I was in college and stuff like that. Roaches are part of. Obviously it's getting cold outside, so I'm getting roaches in the house. And whenever one dies, I take a match to it and light it, and then leave it in the middle of the floor so all the other roaches can see what a sick F I am, and they're like, "We're out of here." And it works every time. Whenever I burn a roach and leave it in the middle of the floor, I don't have a roach yet for the entire season. So I'm just telling you, it's crazy.
Some of our listeners might burn other roaches. They may be confused as to what we're talking about.
Yeah. Hey, I wanted to get into the story, and you just reminded me of it, too. So a little bonus coverage here on Darkside of the Pooch with Dr. Rab Stewart from the Rossbridge Animal Hospital, exclusively on Tony Kurre Radio. I am Tony Kurre. Did you see the story about what they're doing with the crustaceans and lobsters now? You can no longer boil crustaceans or lobsters because they have discovered that they have feelings, that they can actually feel the pain of being boiled alive. And so now they're going to talk about another humane way, if there's a humane way of killing a lobster before it is served on dinner plates. Have you seen that story?
I have not seen that story, but I mean, I see their point. I mean, for sure they can feel that. I'm sure it's terrifying for them.
I mean, I can't imagine. I mean, all we're looking for is a $17 a pound lobster meal at Red Lobster. Yet we're boiling this thing, so that's one of those things where I'm okay with it. I mean, from a humane way, since we're going to eat it anyway, we're good to go. All right, we got some Mutt Mail. James is our second dipper here. He was the one that asked you last week about the cats in the litter box. They have a cat room upstairs, and evidently the cats have been missing the litter box, and we don't know if it's because the cat's ass is too big and it's hanging over the side, and then they started to poop on the carpet around the litter boxes. He followed up with his email, and he said, "Thank you so much for talking about my question on air with Dr. Rab. He loved your answer." But he followed up with domination. We've talked about domination in animals, the pecking order in female and male cats and dogs. And he said, does that carry over to human beings? And what he means by that is when he moved in with this particular young lady friend of his, the cats did leave droppings in his shoes. They would pee on his clothing that he would leave on the floor. Do animals sense that they must dominate human beings, and how do you stop that from happening?
Yeah, cats especially. They're super spiteful animals, and that's their calling card. if they see something they don't like or if something changes, they will pee and poop. I've heard it happen. If a client, one particular example, every time the client went on vacation, they would have their suitcase out. They'd be packing their suitcase. The cat would always take a dump in the suitcase every single time.
Dude, really?
Every time. And the cat never pooped outside the litter box for any other reason. But the cat knew, I'm telling you, I truly believe this. The cat knew they were going on vacation. They knew that the cat was going to be left alone. It was angry about it, and it crapped in their suitcase.
Wow.
So, yeah, James he's nailed it. So he moved in. The cats weren't used to whoever the owner was showing affection to somebody else or giving time to the other person or whatever. And so they're going to do some things to show that they are displeased.
And so how do we stop that behavior? Or they just got to get used to it until they finally back off?
I mean, sometimes you can't stop it at all because it's a behavioral issue. It's a cat. It's not easily trained out of them. So it's almost like you just have to do your best to separate them from being able to get to the other person's stuff. And sometimes that's not possible at all.
Yeah.
Now, the other thing that you can do is if it's more of like sometimes it's an anxiety issue. It makes them anxious when things change, they're just nervous. And so the go-to medication for cats that are anxious is to put them on fluoxetine, which is Prozac. And there's a really good option. There's compounding pharmacies that will make a transdermal gel. So that just means that you put it on you find a hairless portion of skin, and that's on the ears, like the front facing part of the ear in cat. So you take these transdermal gels, you rub it on there. And a lot of times if it's an anxiety issue, it really helps a lot.
Okay, Elaine from Montgomery writes, love Darkside the Pooch, 8 o'clock every Monday night. Love the insight from Dr. Rab Stewart. She says, and I like to paraphrase these because sometimes they go pretty long. Pet people like to write long emails. I love to dress my pets, particularly around the holidays. Do you believe my dogs actually like it? She's got 3 of them. A couple of them seem like they enjoy to be dressed. Some dogs don't. And is it okay to dress your pets for outdoors if they'll put up with it?
Yeah, I think that it's totally fine. And I believe that some dogs enjoy it because they like the attention that they might get with it. They may not, I don't think they fully understand it, but they can definitely tell if there's something on their body. And then immediately they start to get praise. They're going to associate that feeling of clothing with, oh, I'm about to get a ton of attention. I love it. But then there are some dogs that don't like it, and I'll put that in the same category as I totally believe that after a dog is groomed, there are some dogs that they just do not like the feeling of being groomed afterwards. I'm not talking during, but after. Their hair feels different, the weight of it is different, and so the change dogs don't like. And so I think that you can put that in the same category as clothing. It's a different feel. They can feel it on their body, whether it's just the composition of what it's made of or the added weight or whatever it is, and they shy away. They don't like it. So it's all just depends on the personality of the dog. But I really do believe that there's something to that.
Mutt Mail here on Darkside of the Pooch. You can hear our show live, brand new show every Monday night at 8 o'clock with Dr. Rab Stewart. He owns the Rossbridge Animal Hospital. You can contact him at 205-208-0301 or Rossbridge Vet on Twitter, Facebook, and social media platforms. Joseph writes that he's got a cat that, and again, I'm paraphrasing here, it's an outdoor cat, but he leaves the garage door open when it gets really cold. It's got a heating pad out in the garage, so it's taken care of. It gets fed, obviously. It's been missing for 2 weeks. How long should he look for his cat, and what is the culprit here if his cat does not come back?
Well, there's a lot of factors that could be at play. If the cat is intact, either male or female, it might be out doing its thing. So that would be my first thought.
How long are cats usually? How long is a mating season when a cat or a dog's in heat? How long does that usually take?
Oh, cats are induced ovulators. So anytime they tie up, they're going to ovulate. So you can almost look at it as cats are almost always in heat.
Okay.
Females. You know, so it could be if the cat's not intact, then roaming to look for a mate is not on the table. You know, they don't have those desires. So, I mean, 2 weeks is a long time, but I've known cats to be gone for months and return. You know, for whatever reason, they decided to, you know, take a sabbatical. You know, I'm not really sure what caused it, but I wouldn't say that the cat's gone for good. The other thing I would consider is age. You know, if the cat was, you know, if it's getting up there, if it's 12 years old or older, then, you know, I would maybe worry more about it. But if it's a young cat that's been gone for 2 weeks, then I think there's still a shot that cat's going to show back up.
He believes that a coyote got it. Chance?
Oh, for sure. Yeah. I mean, anything. Like, I mean, another cat it could have gotten in a fight with another cat. Yeah. And it hit just right. So, I mean, it could be something as small as a fox or a raccoon or a possum or, you know, anything, but definitely a larger animal for sure.
There are all kinds of wonderful products out there that you can have placed, or whether it be a chip or some type of GPS tracking for your dog, in case your dog likes to get out of the yard. I know yours did for a period of time because the fence was down. I've got a blue heeler that will jump the fence every time I let it out, and it usually comes back. How far can a dog traditionally get away from its home if it wants to come back and find its way? Because we've seen these stories where dogs go from LA to Chicago and they show back up 3 weeks later, they find their way. We've all seen The Incredible Journey, the great show that my kids love to watch. But how far can animals usually get away from their homestead and be able to find their way back?
I think it just varies it depends on the dog. You know, I think that there are some dogs that are really resourceful and also just very good directionally. And I mean, just as you said, I mean, miles and miles, or even sometimes hundreds of miles. So I think that it depends on the dog. When my dog takes off, he doesn't go more than probably a quarter mile. You know, I mean, it's almost like he wants to stretch his legs. That's it, you know? Yeah. So I think it depends. It depends on the dog. It depends on what it's trying to do and what it's looking for. But I think in general, dogs can go a long way. They have a really good sense of direction. They have a really good sense of smell. They can smell where they've been. So if they take off and there hasn't been a whole lot of weather change, then they can turn around and find their way back because they can sense and smell themselves.
That's pretty amazing stuff. Jill from Fort Worth, Texas, and she has been blowing me up email-wise. She loves this show. She's got all kinds of great animals. She's got 2 dogs, a Labradoodle and a Pekingese. She loves to take her dogs for walks every day. Her Pekingese does not pee, but it does sniff the ground incessantly, loves it, and then likes to roll around. She wants to know what exactly is it rolling around in, and why does it feel the need to do that? And she calls it air pee. She goes, why do animals have to stop 15 times in the course of 100 yards, but they hike their leg and nothing comes out? What's going on there?
They're trying to mark their territory. You know, even if nothing comes out, they're trying to leave their mark there. And the same thing goes for like the sniffing and the rolling. They're really curious, and they want to sense what's been there, and they also want to leave their scent there.
So nothing comes out. If nothing comes out, then they're not leaving their scent, or is there something that comes out even though we don't see it?
No, there's nothing that comes out.
Okay.
You know, they're making that attempt to leave something there. But yeah, I think Jill's Pekingese is enjoying the scents of other animals, whether it's a dog or not. You know, I mean, they like to smell things that are other animals. And then I think that it wants to leave part of itself there too, to say, hey, I've been here. This is my territory.
Yeah. She said it would take 3 hours to walk them a mile. They like to roll around so much. And I know I walk my dogs. My dogs do the same thing. And some walks, I just want to do a walk, you know, and I don't take my dogs out for a roll around. I take them for a walk. And so I pull them along. And other times I'm like, if I got nothing going on, I'll let them do whatever they want. And they're just happy to be out and doing it.
The other thing that my dog does is when he gets outside and it's nice weather, he immediately runs to the grass, lays on his back, and then almost like does the worm, and he's just scratching himself. You know, he's scratching his back on the grass.
Do you ever do that when you get home from work?
Every day. I like to take my shirt off and go out by our oak tree and rub on it like a bear.
Vinny from Hueytown writes that he adopted a dog from a dog farm outside the Birmingham area, brought it home, took it to the vet. It was very lethargic, and I found out the dog had parvo. Can you explain to me what parvo is? Should that have happened to this particular dog, and what a dog owner, a prospective dog owner who adopts a dog from a breeder or anyone else to keep that from happening?
Parvo is a virus that basically eliminates the intestine's ability to absorb water and nutrients. So if you're curious as to what parvo does to the intestine, if you open up your hand so that the palm is facing you and you see your fingers, let's pretend that the fingers are the portion on the inside of the intestine that absorb water and nutrients.
Yeah.
So now if you make a fist and all your fingers are gone, you don't have the little fingers there to absorb water and nutrients. That's what parvo does. It basically just cuts those things off.
Wow.
So the body doesn't have that ability to do that anymore. So, if you can't absorb water and you can't absorb nutrients, you're not going to live very long.
Yeah.
Now, sometimes the virus, it depends on the viral load that's there, but sometimes parvo doesn't have to be fatal if those little fingers grow back before the dog dies of basically malnutrition and dehydration. That's what kills a parvo dog. But if those little villi, if they grow back before the dog dies, then maybe there's no big action that you need to take. Now that's pretty unlikely when a dog gets parvo. But if you're concerned that your dog has parvo, then you just need to have it tested. And if you don't want to adopt a dog, if you're worried that it might have parvo, then especially from a breeder, I don't know that a breeder would accommodate this, but you can always say, hey, have your dogs been tested for parvo? Now it's not routine that a breeder would do that, but I guess if it was a high-end breeder, you could request that and request evidence that the dog is parvo negative. I know that shelters will not routinely do that because they're a nonprofit and they're working with not a whole lot of resources. So, it's kind of a different story there. But there's been times where, I've told people as a precaution, we need to test your dog for parvo. We don't think it's very likely, but you have a young puppy and it's vomiting and having diarrhea, and those are the common signs of parvo. So we need to test it. And then sometimes it ends up being positive. And in a lot of cases, you can do outpatient treatment. You don't even have to hospitalize them. Sometimes if they're really sick, you have to, because they have to have IV fluids and they have to have medications to keep them from vomiting. The other thing that'll happen is their white blood cell count gets really low. So they can't fight off other types of infections. So they've got to have IV antibiotics to just keep them from getting infections.
The other thing I think is really interesting, and I've gone through the parvo situation. It was really sad. We've got a dog and it didn't make it but about a week after we got it. Was that it's highly contagious through their fecal matter and through their urination, correct? So if you've got a dog with parvo, you shouldn't even let another dog go in the yard it's been in, correct?
Yeah, and it's fecal. That's how they get it, or vomit. If they ingest the fecal material or the vomit, that's how they're going to get it. They've got to eat it. It's not something that's transmitted through the skin. The only way it could be like a roundabout infection through the skin, potentially, if it's on the fur, and they lick themselves, then yeah. But, they've got to ingest the virus. But, we tell there's a lot of talk of vaccines right now with the coronavirus.
Really?
But yeah.
It was the word of the year, by the way.
Oh, well, I'm sure it's probably going to be the word of the next 10 years. So anyway, they need 4 distemper parvo vaccines, and distemper it's a different virus, but that's what we call the vaccine. Most people shorthand and say distemper parvo vaccine because it prevents parvo and distemper. But routinely they need 4 of those so that their immunity to parvo will be as high as possible. But they can still get parvo even if they're vaccinated. It's extremely unlikely. I've never seen a case of parvo in a dog that's had the adequate number of parvo vaccines.
It's time to head. Yeah, go ahead.
Yeah, but you can still get it if you haven't had that full series of the vaccine. So they need 4 of them. But once they've had 3, then you feel pretty comfortable with them being boarded at a boarding facility or going to a groomer or going to dog parks, being around other dogs. But until they've had 3 of those parvo vaccines, I tell people they probably need to only be around dogs that they know have been vaccinated.
It's time to head back to the doghouse, my friend, Dr. Rab Stewart. Tell people how they can get in touch with you. You have a wonderful business. You do a wonderful service. Tell people.
Yeah, you can reach us, 205-208-0301. You can also email us at rossbridgeanimalhospital@gmail.com. We're also on Facebook, so you can send us a Facebook message. You can check out our content there. We're also on Twitter, too. We're not super active with Twitter.
You should be. Get on there.
I know. I can't find the time. I need to hire a social media manager.
It takes you 30 seconds and retweet my stuff. I put stuff out every single week about this wonderful program. Darkside the Pooch, every Monday night, 8 o'clock with Dr. Rab Stewart from the Rossbridge Animal Hospital. Thank you, brother. We'll talk next week.
Thanks, man. Can't wait.